Hey guys. All right. So, welcome back to my channel. I think it's time for a little update on clinicals. I have done about 3 weeks worth of, well, 3 weeks of clinicals. I'm only going 2 days a week right now because that's how many days my preceptor's there. She works Mondays and Tuesdays. But I did have my school send over paperwork. There's another PMH&P at this practice, and the owner is a CRNA, and he administers ketamine therapy and TMS. And they both volunteered to let me do some hours with them. So I had my school send over paperwork to add on both of them as like supplemental preceptors. And I was told it's been signed and sent back. So now I'm just waiting to get the official okay so I can make sure that I get my 200 hours in before December 13th. I think I've got like nearly 50 hours right now. I have stayed over extra a couple times in the shifts that I've been there to make a couple phone calls and observe some of the ketamine therapy and monitoring and observe the brain mapping for TMS and the therapy itself. So I've been able to add on a couple extra hours, which has gotten me near 50 at this point. So what are my impressions? Let's see. It's a private practice owned by a CRNA. It specializes in treatment-resistant depression, and therefore we have the ketamine therapy and the TMS. So it is a particular population that we're seeing there. And because it's private practice and a particular patient population, it is maybe a little less strict than some of the other clinical formats that I've seen. It's very much, I own this place, and if things don't work out, we'll have to refer you somewhere else. If we're abusing the situation, we'll have to refer out. So the owner essentially told me, hey, you can be making phone calls, you can help with intakes, you can do this, that, and the other. So you're not going to mess anything up because we are very casual here, and it's almost vibe based. It's almost, if that patient's giving you a funny feeling, a funny vibe, talk to me about it, and we'll see if they're appropriate for this practice. Something along those lines, which is definitely something I've never seen before. My hospital was bought by Cleveland Clinic, so I'm currently, one of my jobs is with the Cleveland Clinic. And then my other job is a state job. So we are governed by the rules and regulations of the Ohio State. Like, they just changed the name, essentially mental health department. So very stringent rules, and not as much here at this private practice office. I think I mentioned in my last video about clinicals that I was kind of thrown off at first. I felt like I had to draw some pretty strong boundaries because the owner mentioned me taking some of this work home, making phone calls from referrals that we get, and scheduling them. And I told him I would not be taking work home. I am here as a student. But I did start making some of the phone calls in the office if we have time slots in between our patients, or if we've had no-shows, or certain times of the day I might have some time. So they are writing down some phone numbers and referrals that we're getting, and I'm running through like a short intake questionnaire to see some of the basics, some of the demographic information, name, age, birth date, all that kind of stuff, insurance company, were you referred, do you see a psychiatrist at this time, do you have a history of mental health diagnoses, if so, what are those, are you on medications, have you tried medications before, are there any medications that don't work for you, what are you hoping to get out of your time at this place, do you need to see a psychotherapist, which most people I think aren't used to that word, so just say a therapist. Do you have a therapist? Do you see a therapist? And are you interested in talking to one? Much more comfortable with that now. Do I still think it's part of my student responsibilities there? Probably not. I'm stuck with the preceptor for a reason, and she doesn't do those intakes. It's usually done by the front desk, and then depending on how some of those questions are answered, they'll be scheduled. But I like to challenge myself, so I said, absolutely, sure. Give me the phone. I'll start making these phone calls. And the very first phone call I made, the gentleman I talked to was, he had a big, bold personality. He definitely took charge of the call right away. And I almost thought it was a trick. I almost thought that the owner had a buddy and was like, hey, call or expect a call from our office. We've got this student here, mess with her a little bit. Because it was so outlandish. It was just like the stuff he said, it was, oh, what did they call it? Like boutique clinical stuff. Like, yeah, I've gone here for this like boutique treatment. And it was like, yeah, so I heard about your place and I think you'd be a good fit for me. Okay, well, I have some questions for you. And some of the answers were a little bit shady, like not wanting to give certain information, not wanting to be associated with certain things, doesn't want updates given to his primary care doctor, like this is just between me and you, no insurance, self-pay. It was definitely the hardest phone call I've made so far. And I'm like, oh no. Oh no, I don't know if I'm set out for this. I don't know if I have. He wanted information on TMS. He wanted information on ketamine, like some anecdotes, some what are we seeing? And I'm like, this was my second day. I haven't seen anything. But I did get a good rundown from the owner and from my preceptor. So I was able to answer questions to the best of my ability. And that's what I did. And he was very all over the place, and we got him scheduled, but he ended up canceling. So it didn't even matter. It didn't even matter, which is fine, because my next couple phone calls were very normal. People with real problems that they have tried and failed to address in the past, and they're looking for help, and they want to know if they can finally get the help they need at this place. Very much what I'm used to. Patients reaching out for help. Don't get me wrong, not all patients are nice. Not all patients are easy to talk to. But this was definitely more, I don't know, my speed. The first person I talked to was just like, felt like I was talking to a millionaire who was like, yeah, would you do like gold implants in my ear? Does that help? And I'm like, I think you need to go to like California for whatever you're looking for. Anyhow, so I've been making some of those phone calls. When I'm with my preceptor, I would say 90% of the time I'm observing, which I think is going to change this coming week. I'm getting a feel for how she operates, what her schedule looks like, her routine, how she looks at patients initially, how she does some of her charting, and then how she kind of cleans everything up and submits it at the end. I've been able to help and participate a little bit. I've got a strong medical background. So obviously, not all patients are medical. Obviously, not all patients are psych. Everybody's got a mix of both. We all have different problems that we're dealing with. So I've been able to point some people in certain directions based on their needs, which has been nice because my preceptor, she has done mostly psych care in her practice as an RN through school, and then now as a PMHNP. So I can bring a little bit of that medical side to it and kind of help out and feel like I'm starting to integrate myself into these appointments and speak up a little bit instead of just being the student in the corner. So we're like starting to participate, and the school is really pushing for participation. So I was granted access to the charting system at the site that I'm precepting, and I am able to look up patients and chart at home if I need to, and I'm able to schedule, which I don't know how I feel about that, but I'm supposed to be getting a crash course in that. So the next time I make some of these phone calls, instead of sending it up to the front desk to finish the scheduling, I can just put it in. But anyhow, having access to the charting system means I can look up patients that we have on Monday, and I have a goal for myself to take control of 3 appointments on Monday. We typically see 10 to 11 patients a day. So my goal for myself is 3 patients on Monday. I'm going to look them up ahead of time. I'm going to make myself a little draft, a set of notes for myself. What have they done in the past? Kind of read up on them. What are they currently on? And appropriate questions to ask at a follow-up appointment. So I'll have my PMHNP preceptor with me, and I'll just introduce myself as a student and say, hey, bear with me. It looks like this is what we did at the last appointment. How are you feeling? There's really not as much. Most of the questionnaires are done ahead of time on portals like the PHQ-9 and different assessments like that. They teach us to do it in school. How are you feeling? How many times have you felt like this? How many times? But 90% of the time it's done already. So I'll have access to that. But otherwise, just making sure the medications are appropriate, nothing's interacting, we're not having any side effects, and this is the dose we want to continue on, that type of thing. So it's Friday. My next clinical is Monday. By Monday, I will be prepared with 3 patient charts. Hopefully they are nice patients who allow me to participate, and otherwise, if not, I'll just do the best I can with the other patients that we have, and we'll go from there. Everyone in the office has been so nice. Because I'm making some of these intake phone calls, I had questions like, at what point do I stop accepting patients? There's only 2 PMHNPs, and there's only 1 provider administering ketamine and TMS, and there's only 1 TMS machine. Like, at what point are you full? Are we growing? I kind of had questions about the company. And I went to the owner and I said, hey, I have taken on like 5 patients. So far, we've taken on 5 patients from these phone calls that were appropriate, and we've scheduled them. How many do you need me to schedule? At what point do we turn people away? Like, what are your plans for growth? And I mentioned in the last video that he doesn't always take social cues, how other people might take social cues. So he kind of turned that into a, yeah, I'd like to keep growing this business, and you definitely have a job if you want one when you graduate. I'm like, very sweet. I'm flattered. That's not what I was asking. I just need to know that, do I keep scheduling these people? Do your PMHNPs have enough slots that they can see their patients on a regular enough basis that we can keep taking people on? But I'm not going to lie, I was in the back of my mind, I squealed a little bit in the back of my mind, because I kind of have no doubt that I could say the right things to this owner and could probably find myself in a position where I could work at this place. And depending on how difficult it is to find a job after graduation, like, that's a good feeling to have. I had a hard time as a new nurse. That was a long time ago. Everyone needs nurses now. But for PMH and Ps, I've been looking up jobs, and a lot of them are kind of unknown. Some of them are a little scammy. They're like all telehealth, which I don't exactly like. I like having a relationship with the patients, especially as a new PMH and P. I don't want to make a mistake by not catching something over like a Zoom call. So that perked me up a little bit. I was excited and honored by that little slip of the, yeah, we would hire you. That's just how he talks too. It's not like he was brushing it off. Like, yeah, sure. Keep making your phone calls. That's just, that's how ideas get thrown around at this place. Like, what do you think about it? Yeah, we'll try that. What do you think about this? Oh, yeah, we can give it a shot and see how it goes. So I was sick like a week ago, and I'm losing my voice very easily. So bear with me. Also, it's freezing in Ohio now, so my nose is constantly running. Just clear running. So, just as I suspected, I have learned so much at this clinical site. I feel like I've learned nothing through school. I feel like school is very task-based. It's get this done, move on to the next thing. And sometimes it's very specific. So instead of like thinking big and then kind of honing into what we might see specifically in these different diagnoses, it's like it starts specific. And then I feel like I have to like figure out what is actually going on in general. But in practice, I get to visualize the patients. I get to hear how they talk. I get to see how they dress. I get to see their eye contact. I get to put it together in my brain, think about their diagnoses, think about the medications they're on. And my preceptor is an instructor at another local school, and she's full of wonderful wisdom and pearls. And I would say that I've already got more information out of this preceptorship than I have gotten from my education so far. I think my education, or the knowledge that has stuck with me, has come from precepting, books that I am just reading start to finish, not like textbooks, but I just finished, I think it's called The Devil You Know, and it is patient cases and insights from a psychiatrist based out of the UK. She worked at Broadmoor Hospital for a while. She did some private practice. She did some legal work. Very interesting, and it kind of shows you her thought process and how her interactions went. So I felt like I got some decent pearls from that. There is, I think it's Memorable Psychiatry. They make YouTube videos, but they also have a book, and they have two books actually, Memorable Psychiatry and Memorable Psychopharmacology, maybe. I have started reading the Memorable Psychiatry from start to finish, page 1, page 2, like not just like, oh, we're learning about COPD. We're learning about OCD. Let's flip to that chapter and figure it out. No, front to back. Front, it gives a nice intro of psychiatry and looking at patients, meeting with patients, different tests that we might use or screening assessments, and then it dives deeper into the diagnoses. And I think just reading it from start to finish, front to back, I haven't gotten there yet. But what I have read has been very helpful in just creating a story out of it. It's not panic. Like when I'm doing schoolwork, I'm in panic mode. It's like, I've got to get this in. I've got to make sure I hit the requirements. I'm thinking about everything except for the actual material. When I'm just reading a book, I'm just capturing it as a story in my head. And I think that's what's been really helpful for me. And then let's see, the third thing. Oh, I downloaded an app. You are my phone right now, so I cannot open it. Some kind of pocket prep for boards. I did have to pay for it, but I've been doing practice questions every day. At least a 10-question quiz on board style questions. And having to make that decision in test form and having to think it out myself versus researching things for discussion posts or case studies, that has really helped it stick too. Like, oh yeah, see, that made sense. It was in there somewhere. It was in there. I answered the question. I got it right. I read the rationale and I reinforced how I knew that information. So those have been the biggest things. Clinicals, books related to the topic. Since I just finished The Devil You Know, I just started one on attachment theory. I downloaded it as an audiobook because my drive to my clinical site is about 45 to 50 minutes, depending on traffic. So I plan to just listen to that on my drive and get little tidbits about attachment theory, and then test prep questions. Not only is it helpful to reinforce what I know, but also next fall, so in less than a year, I should be able to test. I should be able to take boards as a master's prepared student and then go into my doctorate, like finish the doctorate classes. So it's coming up way faster than I expected, and I want to make sure I'm prepared for it. I'm not going to lie, clinicals are way easier than I expected. And I'm not saying that in a cocky way. I'm saying they felt looming. They felt like this large mountain that I had to climb. And I just don't know if I can do it again. I don't know if I have it in me to go to this new place as a brand new practitioner of this area and start fresh. But the people are so friendly. The patients have been great. The charting system is pretty easy to follow. And I'm much more confident now that I've started. I'm much more confident, and I'm like, I can crush the rest of this. I've got this for sure. With help, obviously. Hopefully all of my clinical sites are as good as this one and have somebody that I can reach out to for questions, for help. And everyone's willing. They say, hey, just stop in. You can get hours in whenever you want. I need to get the official okay on having these people sign off as my preceptor. But everyone on my way out the door after a shift or something, like, hey, Jess, we'll be here tomorrow till like 6 p.m. doing ketamine treatments, doing TMS. So if you got time, you can stop in, get some extra hours in. They're just so nice. So I'm super happy with this clinical site. I also think it's very unique. I don't think that my classmates are getting the same experience. I've talked to one, and she's with a PMHNP that has a private practice, but also sees patients in a hospital setting. So she has mostly shadowed up to this point. She started before me, and she has seen just regular intake. So the patients at the clinic that I'm at are very specialized patients. They've kind of been through it already. And they have been, their process is treatment resistant depression. They have tried things. So they have potential to be a little bit more acute or severe than some other patients. And not everybody uses ketamine. Ketamine, we've barely even learned about it in the classroom setting. I chose it before I even knew I was going to a ketamine clinic. I chose it as a medication. They said, pick a psychiatric medication and tell me the mechanism of action, this, that, and the other. And I'm like, I want to use something different. I bet you we're going to see a lot of SSRIs. I bet you we're going to see a lot of antipsychotics. Let's check out ketamine. And my teacher kind of gave me some extra questions, probably just helping me, like probing me, like, yeah, what about this? It's part of a REMS program. How does that change the setting, or how does that change how you manage these patients? But we haven't actually learned about it. It's never been part of the curriculum at this point. So I think I'll have a really good understanding of how to manage patients, or to at least not be afraid of ketamine by the time I graduate. It won't be this foreign topic to me. It'll be something that I've worked with, seen. So that's been very interesting. Also, I'm not going to lie, I have been loving putting together business casual outfits going into this place. Love it. I'm so happy to get out of scrubs. I think I said that in the last video, but I'll say it again. I have been enjoying getting dressed up to be a professional at this new location as a provider, a student provider, and stepping outside of my RN role. So very fun. I know there are a couple of you that are in school. I know there are some of you that are thinking about school. So let me know what you're excited for, what you're dreading, what you have questions about, and tell me how things are going for you. That's all I've got for this video. So I will try and post regularly. I say that every time, and every time I get behind. But until next time, have a great week. Bye.